Nursing students, if you find prioritization questions difficult, this one is for you. On your NCLEX under management of care, you will find prioritization questions. So let's do this NCLEX prioritization question together. So out of these 4 patients, whose fever is of highest priority? Number 1, a client newly diagnosed with Hodgkin's lymphoma scheduled for chemotherapy with a fever of 109 and white blood cell count of 6,000. I cover lymphomas in my previous video, but if you don't know much about it, you can pause and screenshot this page. Hodgkin's lymphoma is a malignant cancer of the lymphatic system. So typically this patient is going to present with a fever. It's part of the normal signs and symptoms. So this should not be concerning you as something of highest priority. It is an expected finding. So we can cross off number 1. Client with acute cholecystitis scheduled for laparoscopic surgery who has a fever of 102 Fahrenheit and a white blood cell count of 13,000. So acute cholecystitis is inflammation of the gallbladder. Having a fever is an expected finding. So is the leukocytosis. What about number 3, the client with C. diff infection receiving metronidazole who has a fever of 101 and a white count of 18,000? We're expecting diarrhea, fever, and a high white count, and this is also the medication that we will be treating them with. Number 4, client with colon cancer receiving chemotherapy who has a fever of 100 Fahrenheit and a white count of 1,500. So off the bat here, we know that part of the complications for a patient with chemotherapy is bone marrow suppression. So remember, your bone marrow makes all of your blood cells. It's going to make your red blood cells, your white blood cells, your platelets. So if our bone marrow is suppressed, we are going to be at risk for anemia, at risk for leukopenia, thrombocytopenia. So our neutrophils are a type of white blood cell. So if our patient is presenting with a white count of 1,500, you're thinking, oh my goodness, this patient is exhibiting signs and symptoms of neutropenia. So this would put this patient at risk for sepsis, and they already have a fever. That is also not normal. It can signal an infection. So for this prioritization question, if you thought number 4, you are correct. Let me know in the comments if you want me to cover another question.